to a 2-lane highway for a motorcycle down. Okay, coming up, I am considering additional resources. I am considering the fact that I have one patient, I don't see any others. Considering mechanism of injury, where's the bike, how far is the bike away from the patient, is it badly damaged, is she laying on the asphalt, is there any other signs of what's going on? Bike is about 20 feet away, major damage, and she's lying in the middle of the road. Okay, and I'm also considering C-spine, so partner, would you please go hold manual inline stabilization? All right, at this point, I'm getting the general impression of my patient. She appears to be about 20 years old. Looks like she's got her eyes open. I don't see a helmet, I don't see any protective gear. I don't see any blood around her, so I'm gonna come up. Hi ma'am, my name's Brian, I'm an EMT. What's your name?
Danny.
How old are you?
21.
21. What is hurting you the most right now?
My stomach.
Your stomach is hurting you? Okay. So I know my patient is alert, she's talking to me, her airway is patent, she's breathing what appears to be full and effective. You're holding C-spine, so I'm gonna grab the oxygen, put her on 15 liters via non-rebreather mask. I felt a strong pulse, skins look pink, warm, and dry, and I don't see any obvious bleeding, but Danny, tell me if any of this hurts, okay?
There.
That hurts?
Yeah.
Okay. Any of that hurt?
Yes.
Wiggle your fingers, wiggle your toes. That hurt? Right here?
No.
Okay. So I got abdominal pain as far as my killer goes. And proctor says no skin signs are pale, cool, and moist. Okay, so at this point, she's a load and go patient, so what we're going to do is we're gonna put her in full spinal precautions. She's already on the oxygen. As soon as we get in the back of the ambulance, we're gonna put a blanket on her and we're gonna be going to the hospital. So, okay, so we're good. She's in full spinal precautions.
Okay.
And we're in the back of the ambulance. So Danny, do you have any allergies to any medications?
No.
No? Don't move your head, you're in C-spine.
I'm in C-spine.
Are you on any medications?
No.
Do you have any medical problems?
No.
None whatsoever? Okay, in case you have to go in for surgery, when was the last time you ate or drank something?
I had water 20 minutes ago.
Okay, when was the last time you ate?
This morning.
This morning, what was it?
Oatmeal.
Okay. So, the events. So, obviously you're riding a motorcycle, right? How fast are you going?
40.
What happened?
I took a turn too fast.
Took a turn too fast? And did you go over the side of the bike, or did you go over the handlebars?
This side.
Over the side? Okay, at 40 miles an hour.
Yeah.
Did you brace yourself, or did you go head first?
I don't remember.
No? Did you lose consciousness?
I don't think so.
It just happened really, really
It happened
fast.
really fast.
Yeah. Were you wearing a helmet?
Yes.
You were? Were you wearing any protective gear that for some reason got taken off?
Gloves.
Okay, but not a jacket or anything like that? No? Okay. And, okay, that's pretty much the story of what's going on. So now I'm gonna do a secondary examination. So I'm coming up here to the head, I'm checking for any decap, BTLS. Any of that hurt?
No.
No? Checking inside the ears for any blood or cerebrospinal fluid. Don't see any there, don't see any there. Look at me, checking pupils. Pupils look pearl, good. Checking inside of her nose. Danny, open your mouth, checking for any blood, don't see any. Come in here, the back of the neck. C-collar's already on, but any pain there in your neck? Checking for any crepitus, checking for JVD, I don't see any tracheal deviation. I don't see any subcutaneous emphysema in her neck. Checking the chest, any of this hurt? No? Any of that hurt? No, I'm checking for decap BTLS. I don't see no paradoxical motion, no flail segments. And come down here, you said your stomach hurt?
Yeah.
Can you point to where it hurt?
Here.
That one? Okay, so I'm gonna do that one last. Any of this hurt?
No.
I'm palpating for rigidity or distension. Any of that hurt? No?
Kind of.
Okay, a little bit. And here?
Yeah.
Yeah, and I don't feel any rigidity or distension. Proctor says, yes, you feel rigidity, distension in all quadrants, okay? Coming down here to the pelvis, and obviously I would look to make sure that she doesn't have any external bleeding or eviscerations. Coming down here to pelvis, checking downward and inward. Any of that hurt? No, I don't feel any instability, don't feel crepitus, don't see any incontinence. Checking her legs with conflicting pressures. Any of this hurt?
No.
None of that hurts? This one? No. Don't see any decap BTLS coming down here. Any of that hurt? Yeah? And so she's got pain, and proctor says you see a closed deformity of the tib fib. Okay? Any of this hurt?
No.
Okay, good. And at this point, I'm going to check pulses. Can you wiggle your toes again? Excellent. Pulses are good. Any numbness or tingling?
No.
No. Coming up here to the arms. Checking with conflicting pressures for decap BTLS. Any of that hurt? No. This one?
No.
No. Can you wiggle your fingers again? Good. And checking pulses. Any numbness or tingling? No. And when we log rolled her onto the backboard, I would have checked her back, but any pain here?
No.
None of that? Okay, so secondary's done at this point, partner. Can you grab a, oh, you're driving. That's all right. I'll grab the blood pressure. And blood pressure comes back at 120/80. Proctor says no, it's 70/40, okay? Feeling a pulse. Pulse rate appears to be about 70, and her breathing rate appears to be about 18. Proctor says no, pulse rate is 120, and her breathing rate appears to be 24. Okay, so at this point, I'm going to manage any secondary injuries, which this tib fib is a secondary injury, so we take a SAM splint, Kerlax roll, and I'm going to go ahead and splint that, checking PMS before and afterward. And at this point, I feel like I'm going to just reassess her every 5 minutes until we get to the hospital, and she's obviously a major trauma, so. Questions? Good? Yes?
Did you, at the point where you figured out that maybe she possibly had